was curious about the different ways that Dr. Sachs and other therapists would treat ADHD.
What would happen if, I came to you because I had ADHD?
What we do for kids with ADHD is we provide both coaching and therapy.
With coaching, a professional can help a kid develop strategies to improve their life.
For example, if a kid has trouble getting their homework done, a professional can help them develop a schedule for how to manage their time after school. Or if they're having trouble remembering things, they can create a checklist of what needs to be brought to school every single day.
We figure out what you're not strong at and what you need help with, and we'll develop different strategies to improve those things.
Sometimes ADHD can also be managed with behavioral therapy.
And then for other kids, we do something like talk therapy where they'll tell me their problems about being angry or sad or frustrated.
A therapist can help a kid explore techniques and strategies for dealing with a spectrum of emotions, such as sadness, fear, anger, or frustration.
As a child psychologist, I actually like to hear those things because I know that it'll make the kid feel better when they share it.
I also learned that kids with ADHD should pay special attention to their nutrition and diet.
So how can nutrition and diets help kids with ADHD?
Well, nutrition and diet is a really big part of the treatment for ADHD. One of the big factors that makes ADHD worse is sugar. Now, I know kids like sugar in ice cream, candy,
Pizza, cookies, soda, milkshakes, sports drinks, kids' cereals, cupcakes. Yeah, I love all that.
What happens is sugar impacts the communication system. So if it makes it difficult for our brain to tell our bodies what to do. For example, if your brain is saying, oh, I have to go do homework now, right, after school, and you drink a big thing of Coke, you may get a little bit of burst of energy, but what's going to happen is the signal between your brain and your body that says continue to do work, continue to work hard, is going to have problems, and you're going to be more apt to want to do fun things and things that are easy.
In some cases, ADHD might be treated with medication.
Taking medication is a serious subject. For a kid, and especially parents, this can be pretty scary. So I made sure to ask about this directly.
I know a lot of parents and maybe kids get scared with the idea of medicating their kid. But the fact is that ADHD medicine is well researched, and it's been around for about 50 years. So there's a lot of evidence that it works. So that's why we include it in our treatment process. So if you do decide to take medicine, it's best to work with your doctor because everybody's body is different. And there's a handful of good ADHD medicines to try.
Some of the more common ADHD medications you might have heard about are Ritalin, Adderall, and Dexedrine. Each of these may have different side effects. So if you're taking medicine, it's very important to discuss how you're feeling with your parents and the doctor. In researching for this project, I really learned a lot. Most importantly, I learned there are different types of ADHD and different ways it can be addressed.
The treatment of ADHD is controlling it and managing it. It's always there, like diabetes will always be there, but you have to use diet and nutrition and maybe medicine and coaching with a therapist like me to really learn how to manage it.
So if you're a kid and you think you have some of the symptoms of ADHD, you should talk to your parents and consider visiting a professional. The assessment isn't that scary, and you might even find it to be fun and maybe even educational. Who knows, maybe you don't even have ADHD. But if you do, a professional can help create a personalized treatment plan to help improve your daily life.
Because after all, being a kid isn't always easy. So it's nice to have a little help.